Hello, and welcome to this week's program of the Rotary eClub of Silicon Valley. Each week, we connect with and hear from speakers who usually have a message focused on our love for innovation, entrepreneurship, and education. Today, I'm delighted to be your host and speaker on something that is really important and has been recently on the news, the human papillomavirus. This virus is the main cause of cervical cancers and anal cancers. It's an incredibly important topic that affects everyone, so I thank you all for being here today, as well as those of you listening to this presentation. Before I begin, I'd like to quickly introduce the folks on this call. There's Roger in Kamloops, British Columbia in Canada, Raquel in Cartago, Costa Rica. I hope you're there. Vandana from New Delhi, India, Rushton in the Bay Area, and Shags in the Bay Area. And so my name is Ferheen. I am also based in the Bay Area. And so for my presentation, I want to give a quick shout out to my friend and classmate Alejandra, who helped me create this presentation. And so I will begin. Can everyone see it okay? Perfect. Alrighty, so this presentation is about the human papillomavirus. So I want to give a little bit of a background as to what HPV is. So this is a basic information about the papillomavirus. Its family is called Papillomaviridae, and it refers to this taxonomy of non-enveloped DNA viruses. So what that means is that it doesn't have a membrane around it. Instead, it just has this capsid, which you can see over here, right? So this kind of this coat around it, but that's the only thing it has. There are over 100 related viruses, and they're mostly found in mammals. And however, it rarely infects other species. So, if you, there's, for example, there's a cow HPV, but for the most part, it won't get transmitted into, to another species. The papillomavirus infects basal epithelial cells, which I'll explain a little bit more in the next slide. And so this basically means that it infects cells in our skin, and very specifically, again, in the anogenital tract as well as the oral cavity. So this infection, it enters through tiny cuts, or again, microabrasions, which expose the basement membrane. So that's basically lots of, scientific jargon for just saying that if you have a little cut, it can enter through your skin. So this basement membrane, which is kind of the main place that the virus, takes up its home, is, again, in the epithelia. And in the next slide, I'll show you a little picture. And so, the infection usually occurs within 12 to 24 hours. So this is kind of the life cycle of HPV. And so it establishes in the main basal layer. So hopefully you all can see my cursor, but this is the basal layer of the epidermis, right? So this is kind of where your outside skin is, and this is where the virus like gets in through, and then it goes all the way down to this basal layer, then it makes its home here, right? Then it starts migrating upwards, if that makes sense. So the way the HPV kind of attacks per se is that there are these two components within it called E6 and E7, which are both genes, right? And when they become proteins, E6 is a protein that then inhibits something that we have within us called P53. So this P53 is a protein that is a tumor suppressor, right? So if you turn off a tumor suppressor, that means that tumors can form, right? Then E7 is kind of similar, right? Where it turns off this retinoblastoma protein, and then it can also cause cancer. So let's talk about HPV and cancer. So it typically, it usually causes epithelial hyperproliferative lesions, right? And these lesions, basically again, just like cuts, right? And in kind of these growths, right? It usually, for the most part, can regress without treatment. But the infection can also lay dormant for many years. And it can also, so because the immune response, sometimes the immune response doesn't work, it doesn't effectively attack the virus, it can cause then the lesions to progress into cancer. So Let's see. So then what could also happen is that the DNA of the virus can also go inside of the host genome. So what that means is that the virus itself can just become a part of our DNA, right? So there are two main types of cancer that, HPV that cause cervical cancer. It's this HPV 16 and HPV 18. And so some signs and symptoms, so HPV is mainly asymptomatic. So if you get this virus into your system, for the most part, majority of times our immune system is strong enough to fight it off. But sometimes you can also get symptoms, and the main symptoms are genital warts. So warts, they're these kind of small little bumps. They mainly appear in kind of the genital area, and they may itch or they may not. And then if the HPV is turning more into cancer, you'll see kind of irregular spotting, and you might see bleeding after intercourse. And then of course, if you have more advanced stages of cervical cancer, you can have pain as well as discharge and discomfort. So now let's talk about how can you get it, right? So it is a sexually transmitted infection. It includes contact with mucous membranes with someone who has it. The main areas of transmission, again, because it's sexual, transmitted, it's vaginally, anally, or orally. So something really interesting though is that occasionally there's mother to baby transmission. So if a mom has it, she could potentially give it to her baby, for example, during delivery. There have been cases of folks getting HPV in hospitals and clinics. So the way, unfortunately, is that the sterilization methods used may not 100% kill off the HPV, so you could potentially get it from the hospital. Researchers have found that HPV can actually infect your hands, and then you can transfer that to someone. The last thing is that we don't actually know the communicability. So what that means is that we don't really know when it can stop, right? Because there are some people that, again, it stays in their system, so they can infect way after their symptoms have disappeared. So then diagnosis, there are two types of HPV, low risk and high risk. Low risk causes warts, high risk can lead to cancer. And the main way of diagnosing the HPV causing cervical cancer is through, Pap smears, which is a very typical test where a doctor will come in and take out the cells in the lining of the cervix and then just send them in for testing to see if they're abnormal. It's really, really important for people who have, cervixes to get tests often. It's 3 to 5 years is the recommended time. And so treatment. So if you have, again, those warts, for the most part, no treatment is needed unless you feel uncomfortable, and then you can go to the doctor and they can take care of it through medication or surgery. If the doctor has found precancerous cells, they can do something called this endocervical curettage, which basically just removes the lining of where all of those precancerous cells are, so that it stops the spread of the virus and the cancer. Okay, so let's talk a little bit about prevention. So I will share something, with you all. I have not been vaccinated against HPV, and the HPV vaccine is pretty much one of the only ways to stop HPV, or the HPV to turn into cancer, right? It's recommended to be given to children who are 11 to 12, both girls and boys. There's also a new vaccine for people up to 45 years old, but it's most effective for people under 26. And again, as I mentioned, it causes about 70% of all cervical cancers and 95% of all anal cancers. So it's really, really important to get tested. To get vaccinated so that you can, prevent cancer. The other thing that I want to really quickly mention is that, men can have both like the high risk strains of HPV, and then potentially again give it to their partners who are more susceptible to cervical cancer. So it's really important for everyone not only to get checked but also to get vaccinated. So And so the last thing I kind of want to talk about is recently on the news, there has been some, there is a group in Mexico, the National Polytechnic Institute, that announced the elimination of HPV from the cervixes of 29 women using something called photodynamic therapy. So, you know, if you want, I can go into a little more of that. But basically what they did is that they, there's this drug that uses this chemical that it goes into the damaged cells, and they use a laser beam that like destroys only the damaged cells. And they found with this technique that 85% of patients, HPV was eliminated, which is pretty cool. But I also want to stress the fact that this data was not peer reviewed or published, so it's still really preliminary. It's super awesome, and I hope that it's, you know, a therapy that we can use for people who have cervical cancer in HPV. But for the most part, it is, you know, still preliminary. And so these are my references, and I think that is it for my presentation. Give me one. Yeah. So that is it. So I will stop my screen share, and I will open it up to questions.
I'd like to jump in.
Yes.
So while content really interesting, I'm actually very curious about your approach. So when you have looked at this and decided, okay, this is something that I want to present on, something I'm interested in researching and things like that, what got you to that point?
Well, I think that, so that's a really good question. Okay, so first off, I'm you know, because I want to be a medical doctor, and very specifically a gynecologist. I've always really been interested in HPV and how it affects a lot of people. Yeah, I think the statistic right now is that, you know, over 3 million people have HPV, and it causes cervical cancer, and a lot of people are not vaccinated against it, and the rates of cervical cancer are increasing. So, you know, I think in terms of why I wanted to spread this message to our group, is just how important it is to get vaccinated and get tested, and make sure that we're not spreading cervical cancer, because I mean, it's a really devastating, you know, cancer. And I had a friend who passed away from it a few years ago, and she was very young. So, yeah, I guess I hope that answers your question.
Yeah, it does. Thanks. And I'll put in another plug for the work that we'll do as a club coming up to help fund cancer research, the fight against cancer with our Relay for Life program.
Thanks, Justin.
Thank you.
Yes, right.
2 points, Ferheen. The first point is I would recommend that anyone who watches this video is to make a point of forwarding it to your children or your spouses or your grandchildren, so that more people can be aware of this potential cause of cancer, of anal cancer, and also cervical cancer. The second point is, Ferheen, could you explain in very simple terms the signs that a person should look out for, so that that they might know that this might be a possibility for them, which would then lead them to making an appointment with their doctor?
Yes, of course. So okay, so the first thing, of course, as I mentioned, is warts, right? So that's kind of the first sign that you may potentially be infected with HPV. But again, that is really, it happens in some people and not in other people. So for the most part, if you are, you know, if you're a woman or you have a cervix, it's just recommended that from the age of 21, every 3 years, you make an appointment with, your gynecologist and just get a pap smear, get it checked so that, to make sure that you don't have cervical cancer, or again, those precancerous cells, because it's known that if the doctor can catch precancerous cells and get it removed, for the most part, you probably won't get cervical cancer. And then they can check really regularly. And yeah, so that's the only and really, again, unfortunate part about HPV is that it's really hard to detect. There is actually it's not a commonly screened STI, so sexually transmitted infection. So, even if someone goes to the doctor to get tested, it usually isn't covered. So you might have it and not even know it, and your tests may come out clean. So yeah, so that's the kind of tough part about this infection, is that it happens and it doesn't happen, and it can go away and it can stay, and we don't really know. So yeah, so it's recommended, if you haven't made an appointment, please go, and just, to get it checked out.
Other than that, with the 3 or 5 year to 5 year pap smear, is there any other signs that would indicate that there's a possibility that you should, because it's very important to catch it in the first stage?
Yeah. Yes. So besides those warts, it would be any sort of strange discharge, right? So a very common sign of this cancer is you see, kind of spotting or blood outside of the normal menstrual cycle. So I apologize for being a little bit, rough, but that is what it is. So if you see any sort of
it's what it is.
Yeah.
People will talk about their sex life more than money, though. So go for it.
Yes.
If they're uncomfortable with body parts, get over it.
Yeah, I mean, because again, it is a cancer, and it is terrifying, right? But you are correct. If you do catch it early, then the chances of survival are very, very high. So that would be the main things that we can do. But again, I also want to mention the fact that this cancer also, you might not even have symptoms, right? And that's what's really tough about it, is that you might not experience anything, and you might just, you might have some pain, but it might just be normal. You might think, I have this all the time because I'm going to start my period or something like that.
Or menstrual or premenopause.
Yes. Yeah. And you might not realize it. So it's just the best thing to do is to go to the doctor. Yeah. Is it okay if Vandana had a question? So maybe.
Sure.
Yeah. You mentioned about the immunization at the early age, and below the age of 45. So what happens if teenagers are given the immunization injections or medication, then is it 100% sure that they won't get such diseases?
That's a really good question. But just like most vaccines, it's not 100%, right? So, even if you have the flu vaccine, you can still get the flu, right? So unfortunately, it's not 100%, but it is very, very, very good chance that right? Because the main two that cause cervical cancer, HPV 16 and 18, both of those are inside the vaccination. So for the most part, if you do get the vaccine, your chances of getting cervical cancer are very, very, very low. Again, the risk, it's not zero like most vaccines, but it's still incredibly low. So.
And the second question I have is that HPV is of different kinds. Other than cervical cancer.
Yes.
So
yes.
What about, early detection of those and going to the doctor, whether you get it on the skin or in the mouth or wherever?
Yeah. So majority of HPV, so as I mentioned, it also causes, I believe, 95% of anal cancers, and that can affect men too, right? But again, it's right, because of this HPV, it infects the skin. And so, when men go in for prostate exams or any sort of, those like colorectal exams, etc., that's probably the best way that they can also get checked. So it's just, that's the tough part about this virus, is that it's not detectable. And
what about getting from animals? Like people maybe you you come in contact with so many.
Mm-hmm. No, yeah. So there has been no, I believe from the research that I've done, there's no risk of trend, like cross infection between different kinds of HPV in animals to humans. So I haven't heard of any cases.
And the last question is that you talked about, immunization before 45. So does the probability of the disease getting, the disease through the cancer through this kind of infection reduces as you age?
Well, yeah, I mean, if you consider the fact that, again, it is a majority sexually transmitted infection, and if you do have only one partner, right, your husband, your wife, etc., then yes, the chances are, as you age, probably do get lower. So it's just, but again, it's still recommended that, you get the vaccine just in case, because you never know. Does that answer the questions?
No, it doesn't.
No.
Because you are too much focused on whether you have one single partner, you are into a monogamy or a polygamy relationship. But this gets transmitted, as you mentioned, through various ways, even handshake and, other ways. And other than humans also have it in the environment. So the question is that how does what, and it could be residing within a body of a child passed on by the parents, though it is not a genetic disease.
Mm-hmm.
So how do you know when it will, become a disease?
We don't, right? So
and
that's
so it's not the throwing arrows like darts in the blind, saying that this could be the cervix, like focusing too much on one part.
Yeah.
So maybe more deep research has to, be done. And anyway, I have very little knowledge, because before your mail, I didn't even know the medical term, and I just looked at Wikipedia and some stuff with the thought that maybe I'll be able to understand the subject better.
Yeah.
And it would be giving me an opportunity of meeting you also.
Thank you. I appreciate your comment. Maybe we can talk a little bit later. Great. Any other shags? Yes.
As a child, when I was about 11 years old, a friend's mother died. And when we asked my mom what was going on, it turns out it was cervical cancer. Now, my mom had had a hysterectomy, a full hysterectomy. Oh, gosh. She must have been around 24, 25. But then years later, because they left a little bit of ovarian tissue, she developed ovarian cancer and ignored the warning signs, which are also silent. And my sister has taken up the cause to educate people about that. Is there a connection between cervical and ovarian cancer?
Not that I know of. Ovarian cancer, especially because cervical cancer is majority, again, it's caused by HPV. Ovarian cancer, from what I've done my research on, is not. It's more based on hormones. So it's kind of the hormone imbalances are the main kind of targets for ovarian cancer.
Thank you.
Great. So if there are no more questions, so thank you all so much for joining. And if you found my presentation interesting, or maybe you have a question, please comment below this video. I'd love to hear your thoughts. Members and Rotarian guests, please make sure you fill out the attendance section. And as for my final words, I want to remind you all how important it is to get vaccinated, as well as regularly screened. Please, please, please make an appointment with your doctors just to check if you haven't in a while. So there's also a lot of, fake news about vaccines, and it makes me really sad. It also makes me kind of sad that there are not enough parents and doctors who want to give their children this specific vaccine. But again, it's pretty much one of the only ways to prevent cervical cancer. So please vaccinate, and please schedule an appointment with your doctor. Thank you so much.
Thank you.